best advice? Well, some of the early advice was don't do orthopedics. I guess that would be one thing. Um, that it was very hard to get into. That it was you had to be from a private school, old school Thai sort of mentality. That was a lot of the early advice that I was given by people. Um, of course, I didn't listen to that, obviously. Then I guess when during training, I think some of my peers gave me the best advice, which was to, keep your head down, keep your head below the parapet. Don't draw attention to yourself, which again didn't reconcile really well with the idea of the problems that I saw during training. Bullying, harassment, poor assessment standards, poor reproducibility, all of those sort of things were things that I noticed during training. But that advice about not trying to rock the boat, I guess, was pretty helpful, because I didn't rock the boat and got through training, didn't get dismissed at any stage. And then early career advice was, that started occurring, I don't know, probably for you it's the same, but in second to third year of training, you started getting people whispering in your ear about, why don't you think about doing this? Why don't you go and do that fellowship? If you do this particular specialty, we'll have a place for you in our organisation when you come back, things like that. And some of the advice there, so John Harrison was the mentor of mine in Sydney, really wise man. And he said to me, listen to all those things and agree with them, but do what you want to do. So that was really important, because he said, people will make you promises that will change over a couple of years, and you go away and do a year or two fellowship and come back, and then they don't want you. And that's certainly happened to a couple of the people in probably the 5 years after me that I was mentoring, that decided to go away and do a specialty fellowship on the promise, and then came back to being told, oh, sorry, we've filled that with someone else. Sorry about that. So John Harrison's advice, which was really good, was make sure that whatever you pick, make sure that you're really interested in it, that you can see yourself doing it, even if there's no other opportunities or advantages in doing it. So I think that was some really good advice. And then starting a practice, I think a lot of the advice that I received was try and join a group, because then you've got all the referral patterns, the billing practices, the legal requirements, infrastructure, all of that's already there. You can walk into a practice. What wasn't available for me in the area I went into, in the regional area that I went into, was an established practice. So there was two sort of groups that hadn't really formed groups yet, but they were trying to form group practices. And both of them were encouraging me to join them, or at least set up a group practice with them. And so it would have meant that would have to gone through the whole, setting up, establishing situation with either of them. So again, I picked the one that I thought I could trust the most. So I think trust is something that's really important in our careers, in our if you're picking a mentor, or if a mentor chooses you. There's got to be a lot of trust involved there, because there's many. I don't know about you, but in Sydney there's quite a few cutthroat people that maybe a little bit more than other centres around Australia. And then I guess the mentoring advice that was useful for me early on in my career as a consultant was pretty much everyone knew that I was interested in education. So the mentors sort of encouraged me, most of them except one, encouraged me to take on more roles in education. So more training roles, more committee roles, things like that. And it's pretty soon turned out that was the exciting bit for me. That was the bit that once you get into the routine of regular practice and churning through the cases, it's really important I think, to have another or have an area that you're focused on outside of, treating patients, making money. Family, of course, it's got to be in there some way. So finding something that interested me, either inside or outside of orthopedics, I think was a really good bit of advice that I picked up pretty early on and ran with. And it certainly set me up well for later in my career, to be able to sort of change tacks and become mostly an educationalist rather than a surgeon. I remember thinking when a particular consultant came back, just finished his fellowship, came back and was the new consultant. I was a very junior registrar working with him, and thinking, what are the things that I would want if I was in that position for my trainee to do? So I put myself in his position as a junior consultant and trying to think, what are the things that would help him in his role? And for me, it was mostly about being curious, about being interested in what sort of challenges he was having at the time. So try to show a little bit of empathy for the position that he was in. And so that then sort of continued on. So the kind of things that I was doing with when I was training, I probably was much more, I think, competitive at that stage. Trying to. It was probably all about me. It was about improving my skills, getting access to cases, being hungry, all of those sort of things. And you probably did the same thing. But when you start preparing for the fellowship exam back in the days when we used to be towards the end of training, you form a study group. And that study group, then you realise that these are the people that are going to help you across the line. These are the people that are going to build your knowledge, because we had people in my study group that had all these different areas of expertise, and we all learned off each other. And so that peer group learning, I think, was really important. It was a lot more effective than the bone school sessions and things like that. So that peer group learning was really important. I guess the way I deal with trainees from a junior consultant level to, maybe in the last 10 years, would be more around treating them more as an equal, or in fact, not just treating them, but actually encouraging them to think as an equal, to try and to early on, first meeting with them, establish that I want them to behave like a consultant, even if they're first year trainees. I want them to take responsibilities, and to sort of work alongside me rather than working under me. I think that's the attitude that I changed. Whereas early on, it was pretty much I was the boss and I was telling trainees to do this. Why haven't you done that? Okay, we've got to learn this bit. Whereas, probably the last 10 or 15 years, it's been much more about I guess it's more, in educational terms, more learner-centered. What are the things you want to do? How are you going to be, what actions are going to show that you're behaving like a consultant? What are the things you need to do to take on responsibilities? Things like that. And certainly, I think I was much more supportive of trainees if they were having problems, maybe in the second 10 years of my career rather than the first 10 years. And I think that's probably also because I was much more focused on myself at that stage. Establishing your career, getting a referral base, working in the hospital system, all of those things as a new consultant was taking a lot more of my attention rather than actually focusing on the learners. So, but I think since about 2000 and probably 2010, something like that, I was much more focused on what issues were they having, how can I help someone who's having a problem in training, how can I help them, move past an issue and try and reframe it as, this is not about you underperforming, this is about you being at an area where you need to improve. So trying to look at it from an improvement mindset rather than a failure to perform mindset. So I think that changed. And what they did then is help me establish a lot more bonds with the trainees that came through. Some will say that, some will say that it wasn't. I don't. But certainly, I think I mentored a lot more people in my second half of practice. In that after that first 10 years, I was a lot more supportive, understanding, and constructive, I think would be the way that I'd put it. And I can think now of a number of trainees that had issues that I worked with, who are now fantastic members of our community and doing great work and in great roles. So it's certainly a rewarding thing to see later on. Well, I don't do a lot of work now, although education is my work. So my work is education for Uni of Newcastle, Uni of Melbourne, and for Avant. Probably my main interest outside of that would be related around family. I've got 3 kids at university now, so they all have their fun times and their issues. We have a family farm that I spend a fair bit of time on now, so that's another interest that I have. And I'd strongly recommend to people getting something completely outside of orthopedics, because you can sit on a tractor and spend 2 hours and not think once about work or a problem at work, or you can get in a workshop and weld something up and not think about work at all. So I think they're all really important wellness issues to do, have an outside interest. Do a fair bit of sport. I surf a couple of times a week and walk the dogs on the beach. They're probably how much I fill those things in. Okay, well, so it's going to be coloured with my education, focus, and really, I guess if we go back to the AOA 21 review, is a nice thing to think about. What we found is that Australia, New Zealand technical skills training, so operating, diagnosing, things like that, we're all pretty much at world's best standard already. Our trainees go overseas as fellows, and almost universally they're considered highly technically skilled. So they've already got those things. So going back to the question, I think my assumption would be that everyone coming through training is going to be very well technically trained by the end of training. Now, there'll be people saying now, but the numbers have dropped off, the logbooks are less, you can't possibly train doing only 3,000 knee replacements, you need to do 5,000 like I did, that sort of thing. I would say that technical, I wouldn't focus on that at all. We do focus on, in the AOA 21 curriculum early on, about managing trauma, so that will build up your technical skills very quickly to manage the basic trauma stuff. For me, the most important early skills is communication. So learning communication and teamwork. So learning to work in teams where you're an effective follower, you're an effective member of the team, you empower other members of the team, you get the best out of everyone working in the team. That would be, I think, the most important thing to focus on early. And it's hard then, because where do you go? Where do you go to find out how to be a great team leader or how to be an effective follower? Not a lot of resources out there for things like that. Whereas you can go to the surgeon you're working with and say, I want you to teach me how to do an ankle fracture. But I think what I would advise, and I certainly have talked to a lot of the people that I've mentored over the years, that find someone that you respect early on, not for their technical skills, but for their ability to work in teams, the way that the people around them feel, the way that people around them contribute. So find someone that's effective at that, and then really pick their brains. Buy them a coffee, buy them a meal, find out what they do or why they do things, and how it is so effective for them. Sorry, guard dog. So that would be one way of doing it. There's certainly our resources online for leadership, for teamwork, collaboration. type things. But certainly don't forget that you've got this group of consultants that you're working with each, wherever you're moving around for your different hospitals. Find the ones that actually generate a positive vibe in theatres. Find the ones that the other staff in the outpatient clinic want to do things for. So they'll have these knacks, they'll have these abilities to get the best out of other people. If you learn that early on, you will then be able to get the best out of other people. But also I think what you'll find is that your work is more enjoyable because you're in a positive environment, you've got people that have got your back. You will actually find that work isn't quite so hard and you'll be looking forward to going in the next morning. So that would be things that I would say would be quite important. Probably also piggybacking on that would be professional skills. So professionalism, the idea of being altruistic, being able to focus on the patient as the centre of the disease or the centre of the care. Just some of those things often get forgotten in that hunger for getting medical knowledge and technical knowledge. And so whilst it's always there, that hunger is always there in junior residents and trainees, the ones that stand apart are the ones that find they have that hunger, but then they're also really interested in how the systems work, how the teams work. I think they're the ones that, for me, the trainees that have stood out. Yeah, okay. The favourite changes, every time I read a new book or watch a movie. Probably one of the recent ones I read that was really interesting was it's called Nasty, Brutish and Short. So brutish, not British. Nasty, Brutish and Short. And it's a book about philosophy for children. And it's written by a philosophy and law professor, both professions. It's really entertaining, but also there's some fantastic lessons there, particularly if anyone's got kids, right, rather than grown-up children. If you've got kids now, there's so many interesting things that I wish I'd had this knowledge back when my kids were young to use. So I recommend it. I'd have to look up the author's name. I can't remember it now. But it's called Nasty, Brutish and Short. And it's not referring to the kids, it's referring to a quote from Seneca, I think.